afternoon, and good evening. Welcome to another great week of the Global Café. As Luana mentioned, my name is Roxana, and I'm super excited to be moderating today's session and introducing you all to Miss Marta Hajek for the topic of prevention of violence and abuse against older adults. So, as a little bit of a background on Marta, she is the CEO of Elder Abuse Prevention Ontario, the agency mandated to support the implementation of the Ontario strategy to combat elderly abuse through the focus areas of community coordination, delivering awareness-raising education, and providing multi-sectoral training to all who engage with older adults in the course of their daily practice. As Director of Operations, she helped facilitate the rollout of the helpline service in Ontario 211, and since 2016, Marta continues to serve on the Seniors Expert Advisory Committee with the Ontario Securities Commission, as well as Board of Director with the Canadian Network for the Prevention of Elder Abuse. In April, as part of the Canadian Coalition Against Ageism delegation, Marta addressed the UN Open-Ended Working Group on Aging in New York. The coalition advocates for the protection of human rights of older Canadians, and that together we can all really advance the UN Declaration of the Convention for the Rights of Older Persons. More than anything, Marta is committed to ensuring that we all recognize the role we can play in supporting older adults to be safe, feel respected, and have a strong voice. So thank you, Marta, for all you do. And just to hand the floor over to you, can you actually tell us a little about you? With your incredible achievements in the field of older adult protection, could you further elaborate on both your professional as well as personal journey leading to where you are now with the Elder Abuse Prevention Ontario?
Thank you, Roxana. Thank you, Luana, for this gracious invitation. And I'm so very happy to be here. I'm humbled by the number of people on the call, so I hope we have enough time to have an interactive discussion and address some of the issues. My own personal journey, I am of an Eastern European background, and I was raised that elders are to be respected. And I say elders as in my grandparents, my great-grandparents. It's embedded in my DNA in terms of how I view and treat older adults. But increasingly, older persons are being devalued. We're being viewed as frail, and I say we because I belong to this esteemed demographic at this point. We need to shift what that conversation looks like. And when you experience ageism personally, then you really, know where we're coming from. So it was an opportunity to re-engage in the human services sector. I am a geologist by profession. I enjoyed the solitude of working in nature and doing survey work and sampling, but increasingly engaging with humans is what this is all about. And we all have a responsibility to participate in this. So I decided to enter into the work around dealing with younger populations first. I had the opportunity of living in Newfoundland and Labrador and working with Innu populations to try and encourage a better quality of life for the natives there. And we would come and pick up the kids, dress them, bathe them, feed them. And we actually enrolled them into a literacy group at the library in Goose Bay. And we saw what the impact of having just that kind of social interaction means for children. So when I came back to Toronto, there was an opportunity to go work with 211. And there we really did see the magnitude of need from community to have the right information in the hands of individuals when they most needed it. The natural segue was then to work with the Ontario Network for Prevention of Elder Abuse, which has now morphed in through several name changes to become Elder Abuse Prevention Ontario. And the board, in their infinite wisdom, entrusted me with this role to be able to steward the organization. So I'm privileged and humbled and recognize many faces on the call today. So thank you for supporting our work, for engaging with us, and we're fighting the good fight.
Well, thanks very much, Marta, for that. And before we go any further into some of the, I guess, technical content of today, I just want to set the scene to a degree and just hear from you about what elder abuse really even means. So could you share with us some insights about the definition of elder abuse and its different forms, such as financial, emotional, systemic, and physical, for example?
Okay, so the World Health Organization, and I believe we all know this definition already, to be able to recite it in our sleep, is that abuse is defined as a single or repeated act or lack of appropriate action occurring within a relationship where there is an expectation of trust. And that causes harm or distress to an older person. We know that abuse is not homogeneous, just as the recipients of this intolerable behavior are also not one group. It's not a clean slice of who is abused and who's not. But we also know that individuals have different vulnerabilities to abuse. So this is where we try and address that through community conversations such as this to get at the core of what the issues are. Physical abuse, we know, can manifest as slapping, pushing, any sort of unwanted behavior that causes either bruising or any sort of physical manifestation of rough handling. Financial abuse, we know to now be the second most prevalent form of abuse. And that could include anything in terms of the abuser stealing the individual's money, succumbing to frauds or scams, extortion, or the misuse of powers of attorney. Sexual abuse is any form of sexual activity that is unwanted by the older adult. And then there's neglect. Neglect is failing to provide an older person with the care, basic necessities of life, medical attention, things that are otherwise necessary, and leaving the individual abandoned to fend for themselves. And it usually has very dire health consequences. Then there's the emotional piece, which can involve anything from humiliation, insults, frightening or threatening behavior, ignoring the individual, or coercing them into giving up their financial or physical assets.
Well, thanks.
Sorry, I just wanted to add one thing. So in all these scenarios, it really comes down to an imbalance of power, where the abuser then limits or controls the behavior of a senior, and that limits their rights and freedoms. And this is something that we have been struggling with, I think all of us, but is to ensure that everything that we do preserves the rights and safeguards the rights of older adults to live the quality of life that they deserve, we deserve at the end of our journey.
No, thank you very much, Marta, and thank you for going through all of that in extensive detail as well. And one thing that I've also often seen in literature is that elder abuse is often referred to as a hidden epidemic because, you know, just of how much it's really seriously underreported. Can you provide some thoughts on why this is the case and why elder abuse is so underreported, and just essentially what we can do about it?
Well, there are many reasons, and I think many of us in the course of our actions have come across these scenarios, but a lot of it is the shame and the stigma of actually admitting that you're being abused. More often than not, the perpetrators are family members, or as we said in the definition, that they are in a position of trust. So nobody wants to say that I've been abused by my children, that my family is taking advantage of me financially, that my assets are being exploited. So there's that shame and embarrassment to actually admit that this is happening. A lot of the times there is a dependence on the abuser by the older adult for those basic necessities of life. So if for whatever reason there is financial abuse, and we see this increasingly, if the police are involved or any sort of law enforcement is involved, then that abuser potentially can be taken away, arrested, and removed. And then so the older adult is then again left on their own. So who's going to look after them? So oftentimes people will make the choice. I can put up with the abuse, but at least I have food, or I have my medication, or I have someplace to live. There's also the fear of being institutionalized, to being removed into a long-term care environment or to a congregate setting in terms of living. So if we're not able to behave as the abuser would like, then we're suddenly warehoused somewhere. And that is a huge problem. So for individuals of color or ethno-cultural environments where there are different values, or those newcomers bring different experiences to when they come to Canada, they don't necessarily have any trust for the law enforcement or the judicial system to be able to support them. So that underreporting has many barriers. A lot of the times it's just languages, or at the core is people don't know where to turn. And that's why it's so important that we as a community work together to make sure that older adults are informed and that they're educated about what resources exist within their catchment area where they live, or just being able to reach out to individuals like our organization to be able to provide them with support.
Thanks very much, Marta. And we actually have a few comments and questions in the chat already. And Mr. Shmuel Gerushalmi, he's always has great questions and insights. And one question he posed is whether you could speak on the association between social and mental well-being and how that can impact the prevention of abuse against older adults.
So I'm not sure I understand the question.
I think he just really wants to know the connection between social and mental health well-being and how that can impact. So when we advocate to prevent abuse against older adults, for example, how can that impact the social and mental health well-being of that older persons in question?
Well, I think the perfect indicator for this was our experience during COVID, where there was forced lockdowns, there was forced isolations, and that definitely impacted the mental wellness of a lot of older adults. That sense of isolation, being alone, you start to live with your thoughts. But then again, if you are physically being neglected and not being provided with the basic necessities of life, that starts to, you have a sense of abandonment, and that again impacts your mental wellness. So in terms of a society, I think we failed miserably in terms of supporting older adults. Having to ask someone can you go look in on your neighbor? When I introduced myself, that was an expectation, is that you were conscious of the individuals around you, and you made an effort to live within community, to know that everyone around you was okay. And I think a society needs to adapt that a bit more, is to be not just insular in our thinking in terms of this is my world, but I'm part of a bigger picture. And I have a responsibility, as do we all, to look after each other, to make sure that everyone is all right.
Thank you very much. And what about the association of violence and abuse and ageism? So, being part of the Canadian Coalition Against Ageism, can you provide some of your thoughts on, any associations and connections between ageism and then violence and abuse against older adults, if any?
Absolutely. So we know that ageism is at the core of why elder abuse and violence persists. It's discriminatory. There are set definitions in terms of, what is ageism. So it refers to stereotypes of how we think, the prejudice of how we feel, and discrimination in terms of how we act towards older adults. So the coalition's work is extremely important because we are finding through surveys and any sort of engagement with community that people aren't aware of their ageist attitudes. If you think about even how you perceive yourself, when you look in the mirror, what do you see? Do you find yourself saying, oh, I'm getting older? So these are things that have sort of been embedded into society's speak, that vernacular that we use. We need to shift that. And the work of the coalition is exactly positioned to do this, is to change the narrative around what getting older means. It's not suddenly that we're frail and useless. Every older adult has something to contribute to society, whether through work experience. I mean, we're finding right now that, for example, older adults are being asked to stay longer within the organizations that they work because there isn't the attrition of younger talent to be able to pass on that legacy of information. I plan to live and work in this as long as I possibly can. And I think many of us share that sentiment. It's great to retire and, go on a cruise and do all those other things that, again, are stereotypical, riding off into the sunset approaches. But there's so much that we can be sharing between each other to make our world a better place.
Thanks, Marta. And I see Miss Mary Murphy, you posted a question regarding gender dimensions. Can I please ask you to unmute to pose your question? Perhaps she may be having some sound issues, but maybe I can pose her question on behalf, Marta. Essentially, she wants to know some of the gender dimensions of elder abuse and whether there's anything you can say in regards to that.
Well, again, the data, in order to be able to enforce this kind of a response is very sporadic. One of the issues that we face, I think, worldwide is that data collection around elder abuse, and to provide us with the adequate slices around what is the impact to older populations as opposed to younger. It's something that we're advocating for because we need to know what those impacts are. So if we as a country were to lead the charge in terms of data collection, we would have a more robust business case than to approach government or those decision makers so that we could then put the proper resources in place. Having a community center, 30 miles away when there are issues around transportation barriers, language issues, and so forth, community centers that are intended to serve a senior population, but are so far out of reach that they are not positioned properly. So that data piece is quite key. We know that older women are definitely being abused and are experiencing domestic violence as well as intimate partner violence. And there's a great deal of literature that's been coming out of the Western University, and again, some of you as authoring these papers around what the impact has been to older women populations. I would invite you to visit our website because there's a wealth of papers and reports and documents that we've been accumulating for just this purpose so that people can reference this and get better acquainted with what the facts are.
Thanks so much, Marta. We'll make sure to put the website link in the chat again. And I know she also posted a question on the term vulnerable people. So would you like to unmute and pose your question to Marta? For Miss Maria Aurora Fenich, if you're able to unmute.
Oh, sorry, I didn't realize. Apologies for that. So I'm just intrigued about using the term vulnerable to describe the older persons. Personally speaking, I don't like using vulnerable because for me, it's kind of this society. I'm referring to the vulnerable. It's because society has failed the older person. And that's why we insist as calling the older person vulnerable. But in a way, the older person is not vulnerable. Kind of, what's your opinion on this?
Well, the vulnerabilities come from those experiences. So for example, if an older person is not receiving their medication or if they're not receiving proper nutrition, then their quality and their health is diminishing. And that makes them more vulnerable to illness, to falls, bruising, so forth. They're in a weaker state, and therefore they are more likely to experience physical abuse in a way that a healthy person necessarily wouldn't. So the vulnerability is not to diminish a person's worth, but it is based on their experience and where they are in their life in terms of their health, both physical and mental wellness. The susceptibility rather than vulnerability.
Thank you.
Thank you both. And there's actually been quite a few comments in the chat regarding cultural and different things going on worldwide. Miss Jane Simmons regarding South Africa, Mahesh Hamadri on some of his information in India. And I see a question posed by Mr. Demosthenes Antonio. Would you like to unmute to kind of give a little bit of context as well as post your question?
Yes, hi to everyone. Our organization in Cyprus is called the Cyprus Third Age Observatory. It was founded to, let's say, safeguard the human rights of all the people in Cyprus, which unfortunately there is a lot of unregistered or unreported abuse in nursing homes or in homes by their children, by their carers, etc. What we have been doing since 2018, we have been educating or training the Cyprus police in identifying signs of abuse, as well as how to handle such cases or how to communicate with older elderly people, etc. But I have not seen that anywhere in the world. Do you know if there are some same practices or same training anywhere around the world? I haven't seen it anywhere, unfortunately.
Okay. Thank you for the question. So one of the mandates of our organization, and we are provincially based. So for those of you from around the world, Canada is a country comprised of provinces or territories. And each of those provinces and territories have their own rules and regulations. So our mandate as a provincial organization is to provide education that raises awareness around what those warning signs are, what are the triggers, what are the risks that people might be experiencing that would then lead to abuse and make them either more vulnerable or susceptible to the abuse. That education comes in all forms. So we deal with seniors groups. We do training for service professionals that work with older adults in the course of their daily practice. Just bringing awareness around what to look for, what those warning signs are. And in terms of interventions or supporting the older adults, the training does provide for mechanisms to be able to support the older adult, to have those conversations. So we train, for example, on risk assessment tools that will provide the service provider with the tools that they need to truly understand, not bombard the person with questions, but have more of a motivational interviewing environment so that you do establish that level of trust where then the senior is then able to disclose. Not everything is a bruise or a cut. Emotional abuse, coercion around financial issues. Again, those are things that start to manifest when we have those conversations. So it's not a one and done in 3 minutes. We know exactly what's happening and here's what you do. It's not that prescriptive. So a lot of the times we need to have conversations with older adults, or service providers, for example, will come to us and disclose that they have issues around their clients, like PSWs, personal support workers, or anybody that's, for example, working in a congregate setting where older adults live. In Ontario, there is no mandatory reporting in the community. There is also no mechanism to really deal with this. Now, let me just step back a little bit. So that mandatory reporting is only in long-term care environments and retirement homes. There is an action line where you can call. There's a responsibility on the staff as service professionals to report to their supervisors and then escalate what those responses might be. The population that this encompasses is only 7% of seniors in Ontario. 93% of the seniors live in community. And during COVID, we saw what that scenario, how it was exacerbated because you don't know what's going on behind closed doors. And unless you make the trip to the person's front door and they open the door and tell you exactly what's going on, which is less likely because again, the abuser is standing right behind them. So it has been a challenge for us to be able to get more into community. And where we have been very successful and extremely grateful is that we work with over 42 volunteer elder abuse prevention networks across the province. They are our link to the community to let us know what's going on. So we would help them with in terms of resourcing. We would support them when there were educational sessions being offered. So we work very closely with them to build that alliance, but they are our community link. And we value that relationship very much. Before I get into funding and so forth, but we have been advocating seriously for funding supports to support these volunteer networks because they're doing their share of heavy lifting. They know their community, they know the individuals that are coming to them, and they require proper support. The amount of volunteer fatigue that we've experienced over the course of COVID has been phenomenal. We at one point had 60 networks. We dropped down to 50% of that when COVID hit. And yet they persisted. And some of our chairs are actually on this call, so hats off to you. But they continue to do this work. And through them, we're able to provide that education and teach people about the warning signs and what those responses might look like. So roundabout way to answer your question, but I've given you a bit more history there.
Thank you very much. Thank you very much.
Thank you both very much. And Marta, under your stewardship, Elder Abuse Prevention Ontario, it just really continues to expand its circle of strategic partnerships across the pan-Canadian spectrum to support at-risk older adults experiencing abuse. And I wanted to draw on the very specific at-risk group of Indigenous older adults and their experiences. Can you share some of the specific, perhaps elder abuse challenges that Indigenous communities may face?
Thank you for that question. So within the last 2 years, we have made a considerable effort to engage with Indigenous populations across the province. It is an extremely underserved demographic. And a lot of the times what we're finding is that Indigenous communities don't necessarily recognize that the abuse is happening or what abuse actually is. So again, we revert back to that educational stream, but I will suggest to you that from our organizational perspective, it's not about coming into the community and talking at people. With Indigenous populations, we are being extremely respectful and we are entering into conversations with them. So finding out what is their experience. Do they know that this kind of behavior is happening? If you think the data collection in terms of elder abuse across the broader spectrum is well below what it should be, it is almost non-existent for tracking this kind of an issue within Indigenous populations. So we made a concerted effort to enter into these conversations and run focus groups those conversations were driven by Indigenous elders, by community members to tell us what those experiences are. What are they doing to combat abuse? And what would they require from us to be able to support those solutions? So in a lot of the communities, there is almost a non-existent health system or a hospital or a clinic even to deal with this. So at what point do we inject ourselves into these conversations to be as helpful and as meaningful as we can to help them drive change? And I'm happy to report that over the course of this last year, we have had a significant number of communities come to us willing to work with us and genuinely wanting to engage. So we are looking forward to those conversations and to expanding those conversations to learn more. We need to learn from each other, and we need to share with each other. So insofar as even when we go out to the Indigenous communities, we changed our logo for those purposes to say the prevention of abuse of older adults, because the word elder has a very different meaning in Indigenous populations. So being respectful of those cultural differences and being sensitive to what the experiences of Indigenous communities have been. There has been no shortage of any sort of reporting around the residential experience. And that is one of the pieces that is extremely significant in our engagement with Indigenous populations. The trauma that this created, and it is intergenerational, is being passed down because we haven't dealt with it. So respectfully, the Indigenous populations that we do engage with, they're not stakeholders, they are rights holders. And that conversation has a very different tone. I have the privilege of addressing the elders gathering next week in Sault Ste. Marie. And I say privilege because the conversation that I had with them last year was life-changing. And I'm humbled that they've invited me back to be able to speak with them further. And this time we're going to talk about what financial abuse looks like and what those safeguards can possibly evolve into within Indigenous communities.
Thank you. Thank you, Marta, for that very comprehensive answer. And I think, you know, I really like the point that you said of we need to learn from one another. And I find that to be very true. Now, heading back to some of the questions in the chat, I just, again, want to remind folks to please be mindful when sharing personal situations, as well as refrain from sharing details just due to the topic of this cafe. But I do see Mr. Mike Wilkinson, you posed a question in the chat, if you would like to unmute and speak on that as well.
Hi, good afternoon, everybody. Well, it's good afternoon here anyway. I don't know what time it is with you, but it's good afternoon here in not so sunny Wales in the UK. Yeah, I work for an organisation called New Pathways. We support people who are affected by rape and sexual abuse. This is our 30th year. I've been working for the organisation for 20 years. And we support roughly about 9,000 people a year, which is not an insignificant number. And about 8% of the people that we do support are in the older persons category, which in Wales is anybody over 55 is classed as an older person. And it dispels a lot of myths really when I'm looking at our data, not only due to the fact that a number of older people that suffer abuse, but there's a few things going on, and a couple of our clients really stick in my mind. We had a gentleman walk into our offices in Cardiff last year, a gentleman in his 80s, and he came in to disclose and tell us that he'd been abused as a 10-year-old boy. So he carried that for 7 decades, and he didn't want any services. He didn't want any help. He just wanted to tell somebody before he died. And that really struck me. And that prompted me to think we need to do more about this. So I've been working with Welsh governments on a kind of an awareness campaign, really, in terms of how do we get the message out there so that people don't suffer for 7 decades. There was another lady that came to us, and her abuse happened 30 odd years ago. And I was speaking to her. And I was saying, okay, so what were the missed opportunities? Why didn't you tell anybody sooner? She said, I didn't know how to find the words, and nobody asked me the right question. I've been waiting 30 years for somebody to ask me the right question so that I could give an answer. Because coming back to what Marta said before, shame and stigma are real barriers, and they're the friend of perpetrators and the enemy of victims, frankly. And that's what had stopped her coming forward, because somebody hadn't asked her the right question when the signs and the clues were there. So something we're doing in Wales, got a program of training called Ask and Act, which is not just about sexual violence, but also about domestic abuse. And we're training people that are likely to engage with communities and older people, and that could be your GPs, that could be hairdressers, could be care centres, whatever, just so that people are a little bit more professionally curious and ask the right questions. And another aspect of our data as well that I've found from looking into this is that people make the wrong presumption that people affected by sexual abuse are younger people.
Yes.
But of the older people we're working with, nearly 40% of them, the event happened, the abuse happened when they were an older person. So these are people that have suffered rape or sexual assault when they've been age 55, and sadly one of our oldest clients has been in their 90s. So I think getting that information out there so that people don't think that it's the only them, I think is key to try and challenging that stigma. So I'd be really interested in it. I mean, it's something we're not so much in our infancy here in doing. It's something we've been doing for a while, but really willing to learn from experiences of others and the work that anybody else is doing. So I'm just delighted to be here.
Thank you, Mike. You make a valid point. It is not the kind of topic that, again, somebody's just going to blurt out. So we have worked with the Sexual Assault Center in Kawartha Lakes in Ontario, and we developed with them in partnership something called a Tea and Talk toolkit. And it's a modular-based approach, but it is done in smaller circles where, again, people come together over tea. And we have these discussions. So they come in the form of a quiz. Have you had this kind of experience, or has anyone, approached you with inappropriate language, or been, inappropriate touching or unwarranted sexual advances? It's in a smaller community environment or in a small discussion group like that, people are likely to more experience that level of trust where they are able then to disclose. And it's amazing how many of these conversations have evolved into people disclosing that they're experiencing sexual abuse. So it's important to get the information out into people's hands. It's important to collect the data, yes. But our first and foremost mission is to support the older adult having these wretched experiences. And so having conversations with them, if it takes one-on-one, I should quantify this. We do not case manage. We do case consults. So if someone reaches out to us and shares an experience that they're having, we will try and help them navigate the system, whether health, legal, or otherwise, to be able to get that personal one-on-one support. We're actually working now with a research group called RISE that is looking for those personal interventions, and where we can provide information over the course of a few minutes. We are working with the researchers to connect those willing older adults to be able to have the RISE team work with them to course correct on their life path and some of the experiences that they're having. We're going to be having a webinar about this relatively soon to be able to share the experiences with our viewers. But back to your point, having those intimate conversations with people where they then tell their story, we're then able to help and impart some supports for them that they need, or direct them to a program where they can get that one-on-one help.
Well, thank you both very much. And I know that Miss Liz Mestinos, you posted a question of how we can work to protect older adults who are in families that may include, long abuse, but long term. Would you like to speak a little bit more about your question and your comment, Miss Mestinos?
Yes, thank you very much. We know from research that quite often those people, and people are saying the same thing, have had abusive relationships inside their families as children or as partners, and it reproduces. Sometimes the power goes to the person left over who had been abused and begins to abuse the person who abused them. And it seems to me you have to go back to the abusive family situations, and that's quite complex. Mm-hmm. I just have some hesitation about the role of volunteers, and wonder if psychology advice centers, mental health centers would be a way of volunteers helping people go to the people who can provide psychological support. And basically, I'm looking for some ideas of how, if you don't have this kind of proactive Anglo-Saxon volunteer mode, which we don't have, we're getting some, but it's not there. What can we actually practically do? I'm aware of the data. I'm not quite sure of what we can practically do on a very small scale, which we are. And I'm wondering if one can use existing state institutions, which are, in our case, mental health institutions, to shuffle people, to advise them to go there and make sure that the psychologists there are trained to provide some kind of support. It's a question. Thank you.
It's a valid question, and I'm not sure I have the be all end all answer of this. A lot of the community centers in our province, for example, do have social workers associated with them, or people that are dealing with mental wellness. We have the Canadian Mental Health Association. There are various arms of whether community agencies or government that can provide those kinds of supports. But it really, when you're dealing with a dysfunctional family, first and foremost, you need to find a solution for how that individual can be safeguarded living in that environment. So those sort of systemic intervention pathways is something that we're advocating for, so that we can do things more consistently across all communities. If you live in a rural environment, you're less likely to have access to those kinds of resources, whether programs or services, or even materials to learn about what's actually happening. When you're in a city center, there's all kinds of choices. So that disparity across even where we live geographically is something that we're looking to, again, course correct so that people have equal access to the support that they require.
Thank you very much. And I know Dominic, Mr. Dominic Ward, you posed a comment actually in the chat. Would you like to unmute and speak a little about your comment?
Yeah, I'm a social worker by trade, a therapist, and it's been my experience that the effects of being abused when people are young can lead them in kind of two directions. Sometimes they get stronger, and sometimes they carry difficulty with boundaries and with sort of creating healthy relationships. It does leave them, I believe, more vulnerable to end up in some sort of a position where someone can take advantage of them because they just haven't developed those skills of standing up for themselves, asserting themselves, and setting boundaries and enforcing boundaries. Those concepts may be quite foreign to them, in fact. So it's helpful probably when we try to intervene, you know, if there's suspected abuse and so on, we might want to make those inquiries about early experiences in a gentle and respectful manner, because as some other people have noticed, you know, sometimes they've carried those secrets for many, many decades, in fact. So yeah, I just wanted to comment on that, and perhaps Marta, you might have some thoughts about this matter too.
Well, it is definitely a behavior that once learned can be perpetuated through further generations. So again, our approach to all of this is more of applying a preventative lens. The more knowledge we can put in front of people to be able to, you know, recognize that whether this behavior is from themselves or around happening to those around them, the more informed we are, the better able we are to safeguard ourselves and those around us. If you don't know it's a bad thing, you just let it continue happening, right? So somebody at some point steps in and says, you know, maybe what's happening to you isn't right. And maybe there are approaches to change the course of how your life is unfolding. This is where I'm saying that, yes, there are professional aspects of this to support older adults, but each of us has a responsibility to look out for each other. You know, we unfortunately, there is a lack of political will to shift this in a significant way. So it's up to us as community to demonstrate what is possible just by living as a community and interacting with each other. We'll bring government along at some point, but you know, elder abuse is not a sexy issue, and nobody wants to be the poster child for elder abuse. But a lot of older adults are now coming forward and wanting to tell their stories, and that's extremely important, because then you recognize that it's not just happening to you, that there are others experiencing the same thing. This is how we build momentum. And this is some of the work that we're doing around the Canadian Coalition Against Ageism, is to build that momentum, to change what that narrative is around an older adult's life course.
Thank you very much, Marta. And I think, hearing your point on political will, I just want to grab that a little bit more to unfold it. So globally, 1 in 6 people, older adults, experience abuse in the community with potentially very severe consequences. You unpack political will, but is there any way we can continue to just all of us raise political will and the prioritization of addressing elder abuse?
So yes and yes. So in terms of the work that the coalition is doing, it's again raising awareness of those ageist attitudes to help society change what that narrative looks like, what the impact is on the life course of an older adult. In terms of political will, we have partnered with the Canadian Network for Prevention of Elder Abuse and Western University to develop something called the Future Us. It's a roadmap on how elder abuse can be combated. And there are sections within that document that encourage people to write to your local public official, to all levels of government, to make sure that that conversation is all inclusive. It's an all government approach. It's not a municipal issue. It's not a federal issue. It's the responsibility of all governments to work together to streamline how those resources are applied and to deal with the issues at hand. So having conversations with people that are decision makers, people that we've elected, they have a responsibility to each of us.
Absolutely.
We need to encourage and remind them of those roles.
No, absolutely. And thank you very much. I think we probably have time for perhaps one more question in the chat. And I see Miss Anna Maria, you posed a comment and question in the chat. Would you like to unmute and ask your question to Marta?
Sure. Thank you very much for the opportunity. The thing is that we talk about, you refer a little bit about volunteers. I am one of them, and it's frequently we find out about older abuse, but when you want to bring that to, to the police, for example, they don't want to cooperate because they don't want to harm the child. I mean, the son or daughter who is abusing them. So one gets paralyzed. And also when you consult with the police, sometimes the police is not very cooperative. So how we can prevent that older abuse, how we can, more than prevent, stop it. Because you feel powerless, and also we suffer. I went through, honestly, I went through stress a lot because I became fully knowledgeable of a grave situation, and it was very, very stressful. So what we do, or how we can also do some advocacy work so the police pay more attention to volunteers and pay attention to this elder abuse that is happening. Thank you.
Okay. From our perspective, we have engaged with law enforcement to provide training to the officers. So when they come out of police college, for example, they may have had 5 hours overall training around elder abuse related issues. In no way is that adequate, and something that we continue to advocate for having that standardized training initially, of course, but that there is ongoing training so that they are aware of what legislation is out there. What are the limitations around criminal code charges? Just really supplementing their knowledge base. Remember, this isn't just the one issue that they deal with. They deal with traffic issues. They deal with all kinds of things. We provide the kind of training in depth that they would be more enriched in terms of their efficacy as a law enforcement officer. So when they do find a situation in the community, they know what they're looking for. They know what those responses should be, or they also know what agencies they can help direct the individual to. It's not just about arresting the older adult. That's not necessarily always a solution, but it's getting at the core of why that behavior is manifesting. And so we work with police to help enforce that. We also have connected police officers regionally within our volunteer networks as well, so that each volunteer network has a touch point in terms of law enforcement. So when there are questions or where there are issues, it's more of a dialogue to work together to find a solution in particular instances. And we've found great success with that. I'm got some of my chairs on the call today, so if it's happening differently, we'd like to know. But we are hearing back that it's a positive interaction and it has been quite successful.
Thank you very much. And Ms. Jane Simmons, you posted quite a few just comments here and there, especially with some experiences in South Africa. Would you like to unmute and further elaborate on that?
Thank you so much. I have founded a nonprofit in South Africa called Go Gogo Go. A gogo is the local sort of word for endearment and a sign of respect for an older woman. But I think this is something that we would be seeing globally. But older women in South Africa are particularly vulnerable. For one of the issues is that they receive a government grant, and we have a 36% unemployment rate in South Africa at the moment. So often the grant, which is like an old age pension of about $100, is the sole income in the household, which makes these older women and men, because it's for men and women, but particularly vulnerable to financial abuse. But I think what also is very important to acknowledge is the physical the physiological impact of elder abuse into other diseases like mental health, like stress, like anxiety, like hypertension. It's not just it's more than an abuse. It manifests in a number of health issues that are particularly impacting older people.
That's correct. A lot of these emotional impacts are impacting longevity in the long term. I wanted to still maybe add one more point. When we talk about law enforcement and what do we do in that aspect, a lot of the work that's being done right now through the Canadian Coalition, the end goal is to have the United Nations declare a convention for the rights of older adults, which would then provide a legal instrument for all global jurisdictions to be able to deal with this. It is a legally binding instrument, and it would allow enforcement in a way that some of us envision. And so it's really important that this convention be declared and that everyone participate and support, even Canada, for example, to sign on and be one of the partners in bringing this to fruition. It's been a long haul, but it is, again, there is more momentum as of the last open-ended working group at the United Nations to move this forward. So the intent is now to put pen to paper and start actually drafting the elements of this convention to bring it to a close.
Thanks very much, Marta, and thank you everyone for joining the conversation. We are slowly coming close to the end of the hour, and I want to highlight that this is a very important topic of prevention of violence and abuse against older adults. I would love to hear your key takeaways for us all today, Marta, but perhaps to allow some time just for you to gather some of your thoughts and all the great discussions we had, we can introduce our next week's topic and speaker. So next week we have the opportunity to speak a little about gendered ageism with key experts Peggy Edwards and Paula Rochon. So it's going to be a great discussion, and my colleague Miss Emma Schmidt will be moderating that session. So back to you, Marta. In a few sentences, perhaps, can I ask for your key takeaways to share with us all today, please?
I think the most important piece is that we continue to be respectful of each other, that we continue to be informed of the issues. It's not someone else's problem. We are part of society. We are part of civil society. And if we're going to impact change for the better, then we need to work together, staying connected, looking in on people that are isolated or marginalized or whatever the term is. If you see somebody struggling, it's important to reach out to them and find out what's going on. They may not necessarily want you to do anything, but at least they have been heard. And that speaks volumes in terms of their mental wellness, knowing that they're not alone. So stay connected, stay informed, and let's work together to change this, because we really do all have a responsibility in this. We remain at your disposal, as do many of our community partners, to be able to support older adults, but to advance the convention more so than ever. If we don't do it now, then when? And thank you for this opportunity to speak with you, to interact with you. And I know that Roxana and Luana will be sharing our website. And on that website, you will find a lot of links to many of our community partners that are specialists in some of these areas. So we'd be happy to connect you with them.
Thank you, Marta, and definitely we'll all be sharing the relevant links on our website, especially for this Global Cafe. And I do just want to echo the chat, Marta. Everyone is saying this was a great discussion. So thank you very much for your time, your insights, and thank you everyone for joining in on this discussion. Also, a very special and grateful thank you to the people working at the IFA who helped facilitate not only this Global Cafe, but every single one. So particularly, thank you very much, Luana. Could not have done any of this without you. And have a great rest of your Friday, everyone, and see you next week.
Be well, everyone.
Next
Thank
week.
you.
Bye-bye.